What happens when a dying patient's only hope is the man everyone thinks is just a janitor? This is the story of Dr. Marcus Thompson, a Harvard-trained cardiac surgeon who went undercover as hospital maintenance to discover the shocking truth about how his staff treated people they considered beneath them. In 30 minutes, this disguise would mean the difference between life and death for a heart attack victim, and 3 nurses who mocked his medical knowledge would watch in horror as he performed emergency surgery to save a man's life. The cardiac monitors were screaming. A 45-year-old construction worker was dying of a massive heart attack. The on-call surgeon was stuck in traffic, and the only person in Metropolitan General Hospital qualified to save this man's life was being told to stick to mopping floors by nurses who had no idea they were talking to their chief of surgery. It started at 11:40. Marcus Thompson walked into his own hospital wearing maintenance scrubs with a simple goal: understand his hospital from the ground up. What he discovered in the next hour would expose the deadly consequences of prejudice in healthcare and change everything about how respect is earned in America's hospitals. Marcus had been chief of cardiac surgery for 8 years, performed over 3,000 heart operations, and graduated summa cum laude from Harvard Medical School. But tonight, pushing a mop bucket down the corridor, he had become completely invisible to the very staff he supervised every day. What happened next would shock him to his core. The emergency alarm pierced the night as David Martinez was wheeled into the cardiac wing, clutching his chest, his face gray with pain. His heart was shutting down, his blood pressure dropping by the minute, and every second of delay brought him closer to death. The nurses were in crisis mode, their patient was dying, no surgeon was available, and time was running out. That's when Marcus made his first mistake. He looked at the cardiac monitors. Nurse Jennifer Walsh, 6 years of night shift experience, noticed the janitor staring at her patient's vital signs and immediately saw red. "Excuse me," she snapped. "You need to move along. This is a restricted area, and we have a critical patient." But Marcus, his medical training impossible to suppress, saw exactly what was happening. "His ST elevation pattern suggests a STEMI," he said quietly, pointing to the ECG readings. "You're looking at a complete blockage of the left anterior descending artery. He needs emergency catheterization or bypass surgery within the next 20 minutes, or you're going to lose him." What happened next would be talked about in medical circles for years. Jennifer stared at him, then burst into laughter. "I'm sorry, what did you just say? Do you think watching TV medical shows makes you a doctor? You're a janitor. Stick to mopping floors and leave the medical diagnoses to people with actual education." The other nurses gathered around like vultures circling prey. Nurse Patricia Kim shook her head in disbelief. "Can you believe this? The janitor thinks he can read cardiac monitors. Next thing you know, he'll be offering to perform surgery." Marcus remained calm, but his voice carried the weight of someone who had saved thousands of lives. "The patient's cardiac enzymes are elevated, his troponin levels indicate significant myocardial damage, and his blood pressure is dropping because his heart can't pump effectively with that blockage. Every minute you wait increases the risk of permanent damage or death." Nurse Rebecca Santos rolled her eyes so hard they nearly fell out of her head. "Listen, I don't know where you think you learned those medical terms, but repeating things you heard on Grey's Anatomy doesn't make you qualified to assess patients. Security should escort you out for even being in this area." But Marcus wasn't backing down. 25 years of medical training and 3,000 successful surgeries had taught him to recognize when a patient was minutes from death. Look at his rhythm strip. You can see the pathological Q waves developing in leads V1 through V4. His ejection fraction is probably down to about 30%. If you don't get him to surgery immediately, he's going to go into cardiogenic shock. The nurses exchanged looks of complete disgust. Jennifer pulled out her phone with righteous fury. "I'm calling security. This is ridiculous. We have a dying patient, and we're wasting time with someone who thinks he's a doctor because he learned some medical vocabulary from Wikipedia." Here's what none of them knew. Marcus Thompson had published research papers on emergency cardiac intervention that were cited in medical journals worldwide. He had been featured in the New England Journal of Medicine for his innovative surgical technique. He had lectured at Johns Hopkins, trained residents at Mayo Clinic and had been personally requested to operate on senators, CEOs, and celebrities. But tonight, wearing maintenance scrubs, he was just another invisible worker that the nursing staff felt comfortable dismissing and humiliating. As Jennifer dialed security, the universe delivered its verdict. The cardiac monitor's alarm began screaming like a banshee. David Martinez was going into full cardiac arrest. "He's coding," Patricia shouted, her voice cracking with panic. "Get the crash cart. He's flatlining." Marcus watched in growing horror as the nurses began CPR, their movements professional, but increasingly desperate as the patient failed to respond to treatment. They administered medications, shocked his heart with the defibrillator twice, but nothing was working. David Martinez was dying right in front of them, and the on-call surgeon was still 20 minutes away in traffic. "How long has he been down?" Marcus asked, stepping closer despite their hostility. 4 minutes, Rebecca replied without looking up, sweat beading on her forehead as she continued chest compressions. "And what are you still doing here? Security should have dragged you out by now." Marcus watched a man dying while the people trained to save him struggled helplessly. He made a decision that would expose everything and change the course of the night forever. "Stop CPR for a moment and check his pulse," he commanded, his voice taking on an unmistakable tone of medical authority. "Are you completely insane?" Jennifer snapped, her voice rising to near hysteria. "We're not taking medical advice from the janitor. This man is dying." But something in Marcus's voice, a note of absolute authority that came from years of commanding operating rooms during life-and-death situations, made Rebecca pause. She checked for a pulse, and her face went white. "Nothing. We're losing him. He's been down too long." Marcus stepped forward, his voice cutting through their panic like a surgical scalpel. "He needs emergency surgery right now. The blockage is complete, and his heart muscle is dying by the sec. EPR isn't going to save him. Only surgical intervention will restore circulation before permanent damage occurs." "Surgery?" Patricia laughed, but it was the bitter laugh of someone watching their patient slip away. "The on-call surgeon is stuck in traffic, and Dr. Thompson, our chief of surgery, isn't answering his pages. We're doing everything we can, but this man is going to die." Marcus looked at David Martinez, whose life was literally in his hands, then at the 3 nurses who had spent the last 20 minutes mocking the one person qualified to save their patient. "Dr. Thompson is here," he said quietly. The nurses paused their resuscitation efforts, confused and frustrated. Jennifer looked around wildly. "Where? I don't see him anywhere. We've been trying to reach him for 30 minutes. Marcus reached up and pulled off the maintenance cap he'd been wearing, revealing his face clearly for the first time that night. When he spoke, his voice carried the unmistakable authority of someone who had commanded operating rooms for decades. "I'm Dr. Marcus Thompson, chief of cardiac surgery at this hospital. I've been working a maintenance shift to understand our operations from every perspective, and right now, we have exactly 15 minutes to get this patient to OR 3 and perform emergency bypass surgery, or David Martinez dies tonight." The silence that followed was so complete that the only sound was the flatline tone from the cardiac monitor. The 3 nurses stared at him with expressions that cycled rapidly through confusion, disbelief, recognition, and dawning horror as they realized what had just occurred. They had spent the last 20 minutes mocking, dismissing, and humiliating the most qualified person in the entire hospital to save their patient's life. While their patient was dying, they had wasted precious time arguing with the one doctor who could perform the surgery he needed. The irony was devastating. The man they had treated as ignorant and unqualified was literally the only person who could save the life that was slipping away because of their prejudice. "Excuse me," Jennifer said sharply, walking over to the janitor. "You need to move along. This is a restricted area, and we have a critical patient." Marcus looked up from the monitors, his trained eyes having already analyzed what he was seeing. The patient was in serious trouble, showing classic signs of acute coronary syndrome that would require immediate intervention. But instead of revealing his identity, he decided to test something. "His ST elevation pattern suggests a S to MI," Marcus said quietly, pointing to the ECG readings. You're looking at a complete blockage of the left anterior descending artery. He needs emergency catheterization or bypass surgery within the next 20 minutes, or you're going to lose him." Jennifer stared at him for a moment, then let out a laugh that carried more disbelief than humor. "I'm sorry, what did you just say? Do you think watching TV medical shows makes you a doctor? You're a janitor. Stick to mopping floors and leave the medical diagnoses to people with actual education." The other nurses gathered around, drawn by the commotion. Nurse Patricia Kim joined in, shaking her head. "Can you believe this? The janitor thinks he can read cardiac monitors. Next thing you know, he'll be offering to perform surgery." Marcus remained calm, his voice steady. "The patient's cardiac enzymes are elevated. His troponin levels indicate significant myocardial damage, and his blood pressure is dropping because his heart can't pump effectively with that blockage. Every minute you wait increases the risk of permanent damage or death." Nurse Rebecca Santos rolled her eyes. "Listen, I don't know where you think you learned those medical terms, but repeating things you heard on Grey's Anatomy doesn't make you qualified to assess patients. Security should escort you out for even being in this area." But Marcus wasn't finished. "Look at his rhythm strip. You can see the pathological Q waves developing in leads V1 through V4. His ejection fraction is probably down to about 30%. If you don't get him to surgery immediately, he's going to into cardiogenic shock." The nurses exchanged glances, their irritation growing. Jennifer pulled out her phone. "I'm calling security. This is ridiculous. We have a dying patient, and we're wasting time with someone who thinks he's a doctor because he learned some medical vocabulary." What none of them knew was that Dr. Marcus Thompson had graduated summa cum laude from Harvard Medical School, completed his residency at Johns Hopkins, and had performed over 3,000 cardiac surgeries in his career. He had published research papers on emergency cardiac intervention and had been featured in medical journals for his innovative surgical techniques. But tonight, wearing maintenance scrubs, he was just another invisible worker that the nursing staff felt comfortable dismissing. As Jennifer dialed security, Marcus heard something that made his blood run cold. The cardiac monitor's alarm began blaring. David Martinez was going into cardiac arrest. "He's coding," Patricia shouted, rushing to the patient's bedside. "Get the crash cart." Marcus watched as the nurses began CPR, their movements professional but increasingly desperate as the patient failed to respond. They administered medications, shocked his heart with the defibrillator, but nothing was working. David Martinez was dying, and the on-call surgeon was still 20 minutes away. "How long has he been down?" Marcus asked, stepping closer. 3 minutes, Rebecca replied without looking up, continuing chest compressions. "And what are you still doing here? Security should have removed you by now." Marcus made a decision that would expose everything. "Stop CPR for a moment and check his pulse." "Are you insane?" Jennifer snapped. "We're not taking medical advice from the janitor." But something in Marcus's voice, a note of absolute authority that came from years of commanding operating rooms, made Rebecca pause. She checked for a pulse and shook her head. "Nothing. We're losing him." Marcus stepped forward, his voice taking on the unmistakable tone of a surgeon in command. "He needs emergency surgery right now. The blockage is complete, and his heart muscle is dying. CPR isn't going to save him, only surgical intervention will." "Surgery?" Patricia laughed bitterly. "The on-call surgeon is stuck in traffic, and Dr. Thompson, our chief of surgery, isn't answering his pages. We're doing everything we can." Marcus looked at each of them, then at David Martinez, whose life was slipping away with each passing second. "Dr. Thompson is here," he said quietly. The nurses paused, confused. Jennifer looked around. "Where? I don't see him anywhere." Marcus reached up and pulled off the maintenance cap he'd been wearing, revealing his face clearly for the first time. "I'm Dr. Marcus Thompson, Chief of Cardiac Surgery. I've been working a maintenance shift to understand hospital operations from every perspective, and right now we need to get this patient to OR3 immediately." The silence that followed was deafening. The nurses stared at him, their faces cycling through confusion, disbelief, and dawning horror as they realized what had just happened. They had spent the last 15 minutes mocking and dismissing the most qualified person in the building to save their patient's life. Jennifer's face went pale. "Dr. Thompson? But you were mopping floors," Marcus finished. "Yes, and while I was doing that, I was also trying to tell you that this patient needed immediate surgical intervention. We've now wasted critical time." Patricia stammered. "We had no idea. Why were you explanations later?" Marcus said, his voice taking on the crisp authority that his surgical team knew well. "Right now, we're taking this patient to surgery. Rebecca, call OR3 and tell them to prep for emergency bypass surgery. Jennifer, get anesthesia down here immediately. Patricia, I need you to push another round of epinephrine and prepare him for transport." The transformation was immediate and striking. The same nurses who had been mocking his medical knowledge minutes earlier now moved with precise efficiency, following his orders without question. They had gone from dismissing him as an unqualified janitor to recognizing him as the chief of cardiac surgery, and the shift in their behavior was as dramatic as it was telling. As they rushed David Martinez toward the operating room, Marcus caught sight of himself in a reflective surface. Still wearing the maintenance scrubs, still carrying the keys to the janitor's closet, but now commanding the respect that came with his actual position. The irony wasn't lost on him. Nothing about his medical knowledge had changed in the last 5 minutes, but everything about how he was perceived had shifted completely. In OR3, Marcus scrubbed in with the same thoroughness he always did, but his mind was racing with more than just surgical preparation. The maintenance scrubs had been like a social experiment he hadn't intended to conduct, and the results were both eye-opening and disturbing. The same medical expertise that the nurses now respected had been completely dismissed when it came from someone they perceived as just a janitor. The surgery itself was complex, but well within Marcus's expertise. The left anterior descending artery was completely blocked, requiring bypass grafts using vessels from David's leg. As Marcus worked, his surgical team, who had been called in for the emergency, performed with their usual precision, unaware of the drama that had unfolded in the cardiac wing. Dr. Sarah Chen, his resident, assisted with the delicate work of attaching the bypass grafts. "Vitals are stabilizing, Dr. Thompson. The new grafts are showing good flow." Marcus nodded, his hands steady as he completed the intricate suturing. "Good. His heart muscle should start recovering once we restore proper circulation. We caught it just in time. Just in time." The phrase echoed in his mind as he thought about those crucial minutes that had been lost while the nurses dismissed his assessment. In cardiac surgery, time was literally life, and those wasted minutes could have been the difference between full recovery and permanent heart damage. As the surgery concluded successfully, Marcus found himself facing a situation he had never encountered in his 8 years as chief of surgery. When he finally emerged from the OR, still wearing maintenance scrubs under his surgical gown, the 3 nurses from the cardiac wing were waiting for him. Jennifer stepped forward first, her face flushed with embarrassment. "Dr. Thompson, we had no idea. I'm so sorry for how we treated you." Marcus studied their faces, seeing genuine remorse, but also recognizing an opportunity for a conversation that needed to happen. "Tell me something," he said quietly. "If I had been wearing my regular scrubs and white coat, would you have listened to my medical assessment?" "Of course," Patricia replied quickly. "You're the chief of surgery." "But my medical knowledge didn't change based on what I was wearing," Marcus pointed out. "The same expertise you respect now was exactly the same expertise you dismissed an hour ago. The only thing that changed was your perception of who I was." Rebecca shifted uncomfortably. Janitors don't usually know medical terminology." "And why not?" Marcus asked. "What if that janitor had been a retired doctor? What if he had medical training from another country? What if he was a medical student working his way through school? You made assumptions based solely on a uniform and job title." The conversation that followed was unlike any that had ever taken place in the halls of Metropolitan General Hospital. Marcus didn't lecture or berate the nurses. Instead, he led them through a discussion about unconscious bias, the dignity of all work, and the danger of making assumptions about people based on their appearance or job title. "The man who saved Mr. Martinez's life tonight wasn't Marcus Thompson, chief of surgery," he said. "It was the same person you thought was just a janitor. The knowledge, the expertise, the ability to read those cardiac monitors, all of that was there regardless of what title you gave me." Jennifer nodded slowly. "I see what you're saying. We treated you differently, not because of what you knew, but because of what we assumed you didn't know." "Exactly," Marcus said, "and that assumption almost cost a patient his life." The impact of that night extended far beyond the cardiac wing. Within a week, Marcus had instituted new policies at Metropolitan General Hospital that would transform how staff interacted with each other and with patients. Every department was required to participate in workshops on unconscious bias and respect in the workplace. The story of the chief surgeon working as a janitor spread throughout the hospital, but not as a cautionary tale about deception. Instead, it became a teaching moment about the importance of listening to knowledge regardless of its source and treating all members of the hospital community with dignity and respect. Thompson continued his practice of occasionally working shifts in different departments, not in disguise, but openly, as a way of understanding every aspect of hospital operation. He discovered that some of the most valuable insights about patient care came from housekeeping staff who spent more time in patient rooms than anyone else, from cafeteria workers who noticed changes in patients' appetite, and from security guards who observed family dynamics during visiting hours. The policy changes that emerged from that one-night shift transformed Metropolitan General's culture. A program was established where staff members could share medical observations regardless of their job title, leading to earlier detection of complications and improved patient outcomes. The hospital also instituted cross-training programs that taught basic medical knowledge to non-medical staff, recognizing that everyone who worked in the hospital was part of the patient care team. David Martinez made a full recovery from his heart surgery, returning to work 6 weeks later with a new appreciation for the team that had saved his life. When he learned the full story of his treatment, how the chief surgeon had been dismissed as just a janitor while trying to save his life, he became an advocate for treating all hospital workers with respect and recognition. The 3 nurses from that night became some of the hospital's strongest advocates for the new policies. Jennifer Walsh, in particular, used her experience to lead training sessions for new staff, sharing how her own biases had nearly cost a patient his life, and teaching others to recognize knowledge and expertise regardless of where it came from. The maintenance staff at Metropolitan General noticed a significant change in how they were treated by medical staff. Conversations replaced dismissive nods, and their observations about facility conditions that might affect patient care were suddenly valued and acted upon. The hospital became a place where a janitor's concern about a leak in a patient room was given the same immediate attention as a nurse's report about medication side effects. Marcus's experiment had revealed something profound about human nature and institutional culture. The same expertise that commanded respect in one context was completely dismissed in another, not because the knowledge was any different, but because the social cues and assumptions people made overrode their ability to recognize competence. The story became a case study in medical schools and nursing programs across the country, used to teach future healthcare professionals about the importance of listening to all voices in a medical setting. It demonstrated how unconscious bias could literally be a matter of life and death, and how creating inclusive environments where all team members felt valued could improve patient outcomes. Years later, Marcus Thompson would often reflect on that night when he almost watched a patient die while being dismissed as unqualified to help. It taught him that respect shouldn't be earned through titles or uniforms, but through the content of one's knowledge, character, and contribution. More importantly, it showed him that creating environments where everyone's voice was heard and valued wasn't just about fairness, it was about providing the best possible care for patients. The maintenance scrubs he wore that night were framed in his office, not as a trophy, but as a reminder that expertise comes in many forms, and that the person who might save a life could be anyone, if we're willing to listen and look beyond our assumptions about who belongs where and who knows what. David Martinez's heart had been saved by surgery, but the real healing that night happened when a hospital learned to see past uniforms and job titles to recognize the human dignity and potential contribution of every person who walked its halls. Sometimes the most important medicine isn't found in a pharmacy or operating room. It's found in treating each other with the respect and recognition that every person deserves.